Now, a hospital is about the most profound place in modern American life. Most of us came into this life in a hospital, and most of us will depart it from one. And with all of the ambulances and helicopters arriving with gunshot victims and trauma victims, babies being born, hearts being transplanted, the complexity is overwhelming. It's more than anybody can hold in their mind. But it's not more than an AI can hold. Imagine an AI wrapping the hospital, aware of the status of all of the patients, their journey, and inferring the next best actions for all the clinicians and workers in the hospital, and sharing it with them in their language, coordinating that care. Wrapping that hospital administration for the providers will dramatically reduce their complexity and increase their quality and productivity. A small example of this is the sepsis work I described earlier. HCA brought together teams of clinicians and engineers, and I was privileged to be one of them. Together, we wrapped the subtle complexity of sepsis development in an algorithm and a workflow, giving clinicians hours of advance warning of sepsis. And with that tool, they're able to save thousands of lives a year. It was a lifetime privilege to be on those teams. But it's no longer all that can be done. Machines that can read and write give us new opportunities. Consider the case of Martha Mills. She was a British teenager who, on a vacation with her family, slipped on her bicycle and jabbed herself in the abdomen with the handlebars. The pain was intense. She went to the ER. It didn't get better, and she was admitted. She deteriorated over the weekend and ultimately succumbed to death. It was a tragedy, an avoidable tragedy, because the signs and symptoms of sepsis were all over that chart, but they were missed in the clinical and all too human complexity of modern medicine. Now imagine an AI that has read the medical textbooks, has read the clinical literature, and is connected to those charts in real time and can read them. Such an AI would know about sepsis and would not miss it. Most excitingly, imagine that AI exists outside of the traditional healthcare system, allied and aligned to Martha's family, who were at her bedside, disempowered through this whole experience. Such an AI could have told them, Martha is critically, deathly ill and needs to be in a pediatric ICU right now.